Hey guys, tonight we're going to talk about tuberculosis, what it is, and how we can help. So, tuberculosis is an infectious bacteria, and the thing to know about it is that it requires extended treatment. So, we've talked about pneumonia, which, if it's bacterial pneumonia, then we can take an antibiotic, and usually it's resolved in a couple weeks. Treatment for tuberculosis takes months and sometimes over a year if it's resistant and stuff like that. So this definitely is it's what's considered a public health concern, but it's also very tricky to treat. So it's very important that we identify it quickly and that we give them the treatment and the education that they need to be successful in their treatment. So before I get too far ahead of myself, so it's contagious respiratory infection in the lungs, and the people that are most at risk for this are going to be those that are homeless, those that engage in drug use, and people that live in close quarters like nursing homes. So, the reason that these people are more at risk all just has to do with how it's transmitted. It's airborne, which we'll talk about what that means here in a few minutes. But effectively, it's anyone who's in close quarters with people, maybe doesn't have the same resources that other people do to keep up with their health, but it's really about people that are kind of staying close together with one another. And the drug use just has to do with it's not actually the drug use itself, it's just about the kind of lifestyle that most people that are drug users, the kind of people they're around, and the close quarters that they can commonly live in that can lead to the spread of tuberculosis. So, what does tuberculosis look like? Early on, they're going to complain of night sweats. They're going to say they woke up in the middle of the night, the night sweats, the fever, general cough. Like the cough is usually what they come in and complain about. Like, I've had a cough for a long time. They can also have weight loss and fatigue, like general malaise, not feeling well. If they're having shortness of breath or blood in their sputum, because blood in your sputum is what's called hemoptysis, that's a late sign. So that's going to show you that, like, hey, their disease has progressed or it's worse than, it's not like early on in the disease. So effectively, the longer you're in the disease, the more severe your symptoms are going to be. And if you're having that shortness of breath and hemoptysis, that's saying, hey, it's this disease and this infection has really dug into my lungs and has started to cause some real serious problems. So overall treatment is, of course, first and foremost, we want to support oxygenation. So they may need oxygen therapy. It's just going to depend on the severity of their symptoms and how well that they are, maybe what other disease processes or history they may have. So we always want to check their oxygen saturations, listen to their lungs, and keep close with that. And like I mentioned, then they need extended antibiotic coverage. And I'll go more into these drugs when I talk about them on my medication PowerPoint, but I did just kind of include them in a quick tidbit about them. You can see there's five of them here. You may be wondering why so many antibiotics. And that's because this is a very resistant infection and it's gotten really smart. And this is these medications, these patients have to take usually at least three to sometimes all of them, like usually it's three to four. Most patients have to take three to four of these, and the reason I put these side effects is not because like, oh, I have to know every side effect for every drug, but keep in mind, just think of like how hard it would be to take all these medications every day for almost a year and look at those like side effects that they can cause. This is why we have a big problem with compliance with tuberculosis, and that's why it's really important. We'll talk about this in a minute about how important it is to use your role as the nurse to make sure patients take these medications. So you can see like some of them cause nerve pain, joint pain, changes to your urine color. Some can cause toxicity to your organs, vision problems. Like, there's a lot of like really serious problems. And so keep in mind with these medications that it can be hard sometimes if it seems like a patient's like, being resistant to taking that. These are some serious and really uncomfortable side effects. So always want to keep that in mind when we're thinking about the treatments we're giving patients. So let's talk about the airborne isolation. So I told you that this infectious process is spread through the air or it's airborne. So that means that, if I'm in a room with a person, even if I have like, we love our, COVID masks now, that is not enough to help protect me from someone. It's not a droplet where like, part of their spit or something comes out, and that's what spreads. It's actually just in the air. And so every breath that they breathe, it's possible to get exposed. Now, there's a common misconception that TB is super, super easy to get, and that if you're just around a person once for a very brief time, that you're going to get it. Usually it takes prolonged close contact. However, as healthcare professionals, what do? We do assessments. We're in the room, we're around the patient. So getting the patient in isolation ASAP is key. We put them in what's called a negative pressure single person room. So they need to be by themselves. We put them in a negative pressure room. And what this does is it helps to keep the air particles that are collecting from this patient in this room, and so it doesn't spread to other people. We also need what's called an N95 mask. You might hear about it, a mask with a HEPA filter, etc. And what this is this is a special mask that creates it where I'm not breathing in the air around me. And so that allows me to be in that patient's room without contracting those particles that are present in the air from their breathing. There's other PPE that may be required as well. It's just going to depend on the hospital that you're at and what their requirements, and then also what activity are you doing. So for example, for me, when I go into a patient with tuberculosis isolation room, if I'm going in to give a bath, I'm going to do the works. I'm going to have on my gown. I'm obviously going to have on my gloves. I might have some eye protection on. And I'm going to go in there and make sure that I'm taking, all the precautions to cover every part of me, because I'm about to get really close with them. But if I'm going in the room real quick, just to, fix the monitor or administer a medication, it might be a little different, just some gloves, etc. So you're going to just go per your hospital policy. And depending on how in depth and how close that you're getting to that patient. So that might look a little bit different. The CDC guidelines only require the negative pressure room and the N95 mask when they're talking about required PPE. So to diagnose TB, there's a couple of different test options. These can be very confusing. Because some people don't understand why there's so many and there's different ones and stuff like that. So let's kind of break these down. First, the most commonly used one is what's called a TB skin test. So that's that thing, and I'm sure that you've probably had it at some point if you work at a hospital or even for nursing school, etc. And that's where they go and they they inject something into the thin part of your skin and create a bubble in your arm, and you come back 2 days later and they look at it. And effectively, what they're doing is they're injecting they're testing your body's immune response to tuberculosis on your skin, just to kind of see how you react. Now, if at any point, even if you don't have active tuberculosis, it's going to show up as a positive. So that works well sometimes, but keep in mind too, it also takes time, and you have to make sure that it's administered correctly. So there's other options too. There's what's called a T-spot, which is going to show that you have antibodies and things present to tuberculosis, and that's a blood test. That's a little more expensive. And then there's some people, especially that come from other countries, like there's a couple women from Britain that work with me at JPS, and they always have to go and get the chest x-rays done for their tuberculosis because they received what's called a BCG vaccine. And so in some countries, tuberculosis is a lot more common. And so they actually have to get a vaccine for it, just like we get vaccines when we're younger and growing up. And so because of that, just like anything, if they get a TB skin test or if they get a T-spot, it's going to say it's positive because they've been exposed because they had the vaccine. So what they have to do is get a chest x-ray. Now, a chest x-ray alone cannot tell me that I have tuberculosis, but if I have zero symptoms and my chest x-ray looks clean, it's very unlikely that I have tuberculosis. So that's why patients that have that vaccine usually end up having to get a chest x-ray. But the ultimate best test, the one that's really going to, and this is not what everyone gets, but the best test for a patient that we really think does have tuberculosis is going to be a sputum culture. We usually have to get 3 sputum cultures, what we're doing there is we're, getting them to cough up. It's not the spit that's in your mouth, but the real deep stuff that comes from your throat and from your lungs. And we get them to get enough of that and we culture that because that's going to tell me, do I have tuberculosis right now? You might have noticed I used 2 words there. I said that they might have active tuberculosis. So you're thinking, Is there a different type of tuberculosis? And there is. So the thing about tuberculosis, and this is why it's so tricky, is that there's an active form and there's a latent form. So in other words, I could have been exposed to tuberculosis and I never show any symptoms. What happens is my body kind of puts it in a little capsule, hides it away. But then at some point, maybe I'm immunocompromised, like I end up my immune system suppressed or something happens and it opens up and that tuberculosis comes out. Or maybe sometimes just randomly that tuberculosis activates and starts. So like I could have tuberculosis bacteria in me my whole life and never actually have active tuberculosis. But once they're activated, they become active TB. And that's where I get all those symptoms, the night sweats, the, what do you call it? We call it the fever, the body aches, the weight loss, all that stuff. And so when it becomes active, it requires a lot more treatment. So that's why we need different tests. So the TB skin test, the T spot, the sorry, not the chest X-ray, the TB skin test and the T spot only tell me if I've had TB at some point. It could be latent. I could have been just an exposure. So it doesn't tell me whether I have it right now. The only test that tells me, do I have tuberculosis right now in this moment, is a sputum culture. It's the only definitive test that we can use. All the others we can use together with other tests and they can tell us some stuff, but they can't be definitive. So that's why the sputum culture is the best test. So my role as the nurse is going to be to isolate the client ASAP because it can be like I said, some countries there's an outpouring of it. It can be really bad and cause a health crisis. It can cause a pandemic, and obviously we do not want to do that again. And so we want to isolate these patients ASAP, make sure that they get quarantined into a appropriate room. We want to do regular lung assessments and listen for complications, worsening of infection. Tuberculosis can actually spread to other parts of the body, so we always want to be watching out for that and making sure that the patient's oxygenation status is stable. Like I mentioned, medication adherence is key, and it's really hard for these patients to keep up sometimes with their medications. Like I said, think of the patients that are getting these drug users, homelessness, nursing homes, stuff like that. It's hard for a lot of these patients to keep up with these medications. So there's what's called dot therapy or direct observed therapy, and what that is that it's like a clinic where on a day that the patient, if they're homeless, drug addict, whatever they are, that it doesn't matter. Like they go to this clinic and they just pick up their meds. Like so, pretty much it takes out the denominator of them having to go to the pharmacy, get their meds. Remember to take them at the right time, have the resources they need. Like it's a clinic they go to, they're going to give them their meds on a daily basis to make sure they keep up with them. As a whole, this helps to increase the adherence to it, kind of like having an accountability partner. Keeping their head of bed elevated will help with their respiratory symptoms and help to allow for better expansion of their lungs and prevent complication. We want to do good hygiene practices, and that not only includes like oral care, good hand washing, but teaching them how long they're contagious. We definitely want to let the people that are living with them, kind of know about those precautions as well. If there is anyone living with them, etc., just depending on the person, and make sure that they're not going to be spreading this to someone else. And then all cases of tuberculosis are reported to the health department because it's something that they kind of keep track of in order, since it's such can be a national health problem. So yeah, so that is tuberculosis as a whole. I hope that was helpful. Bye.